Hello, this is a video presentation of an idea. I like to call it a national point of sale healthcare cost collection system. The premise of the idea is rooted in something my mom told me about before she passed away. And that was the principle of, if you wanted to ensure that every car on the road had no-fault insurance, you would just add that cost into gasoline. So for every gallon of gas you put in your car, there would be a tax associated with that, which would go to pay for car insurance. And that's a big leap to go from there to using a point of sale system to collect our healthcare costs, but not really. If we take the idea that when you purchase something and it increases healthcare cost, and we use that principle to collect the cost of healthcare, it seems pretty rational to me. Let me explain it like this. You have an apple and a candy bar. Now, I think most people would agree, and the scientists, doctors would agree, that an apple is better for you than a candy bar. So therefore, the apple would be taxed much less than the candy bar. In addition, let's take the example of a football helmet versus a chessboard. Think when you buy protective gear for football, you are in effect acknowledging that you are participating in an activity that will, over the course of time, probably create injuries and health issues. Whereas if you were to play chess, barring somebody throwing the chessboard at you or sticking a chess piece in your mouth, the likelihood of you getting injured playing chess is much less. So that's fundamentally the principle of how much tax would be added to each item. Now, you're probably saying, well, how would the tax go to pay for the cost of health care? Well, let me show you. This would be you or me, this would be the individual. Now, the individual has an income resource, whether that is a job, a family member giving them cash, unemployment, Social Security, etc. So you have your income resource, which provides income to the individual. The individual then goes to the store. That's just a generic category for anything that any place that you would go to buy something, whether it's a department store, a restaurant, a hotel, sporting goods store, you name it. Any place that you go and you buy something, there would be a healthcare tax on that. Now, this would also have to include stocks, bonds, because if you are participating in a sale in this country, I think that perhaps our society should agree that a percentage of everything that happens should go to keep our society healthy. So if we were to take everything, boats, yachts, motorcycles, cars, homes, sofas, beds, televisions, etc., and lump all that together, that would give us a starting point at which to know I'm sorry. Ugh. So, that being said, you have the individual, and then you have point of sale, the store. When you would buy something, whether it's stocks and bonds, a bed, a pet, whatever, that's where the tax would be collected. The money then is sent to a national health trust fund. The health trust fund then would pay directly the wellness professionals and a private risk management company. Now let me talk about this for a minute because I can hear the socialist outcry already. The individual would choose their doctor. The government would have no say. There would not be any health plans. You like your doctor, you go to your doctor. You wake up in the morning, perhaps you don't have a doctor. You wake up in the morning and you go to a clinic or you pick up the phone and you look at the phone book or get on the line and you find out, where the doctor is. And you go to the doctor, you fill out the paperwork, you have your sets of procedures, and there is no money that changes hands from the individual to the wellness professional. Now, in addition to you choosing the wellness professional, you would also choose a private risk management company. Now, this is renaming the insurance industry. This is a private corporation that has the expertise to understand and to collect data in a secure manner. This isn't the government knowing what you, the individual, are having done. All of that information about your health is kept between you, the doctor, and the insurance company. But unlike the way it works now, where the insurance company is the one that collects the doctors and sets the rate at which they charge you for, hip replacement or, broken arm. The private risk management company collects information on several things. One, they collect information on who you are. They collect information on what you're having done, and they collect information on what's causing the illness or injury. And then they crunch all those numbers and they come up with a set that says, okay, football caused $1 million in injuries. So therefore, we have to collect $1 million worth of healthcare cost from the football industry. So that would be the cleats, the uniforms, the stadium, all of that, would be added up, and then the tax would be added on a scale as to what's causing the injuries. Tennis, skiing, jogging, smoking, drinking, alcohol, skydiving, you name it. The private risk management company or insurance company would be the one to crunch these numbers because that's what they're good at. They're really good at assigning risk. understanding risk. So the individual chooses the doctor. The doctor then sends the information to a private risk management company. The private risk management company sends the information, the tax information, as to what's causing the injuries and how much the government needs to collect to the healthcare trust fund. And then the healthcare trust fund sets the taxes which is collected at the store. Now, there are several things that I'd like to touch on. One, how is the private risk management company paid? Well, they would be paid a set fee for each client that they have. For each individual that they take care of, they would get a set fee. Now, the fee would be collected in the healthcare trust fund, which would be added to the tax, because that would be part of the healthcare system. But most importantly, I think, when we talk about the benefit of the insurance company affecting cost, is that the private risk management company would also be well versed in detecting fraud and abuse. And so when the risk management company proves fraud and abuse, they would, maybe as a reward, be able to recoup half of the cost that they saved the trust. So the private risk management company finds a fraudulent doctor that's that's taking care of a bunch of dead patients and billing the healthcare trust. The private risk management company comes along, works with the Department of Justice. They send the doctor to trial, and the doctor's taken out of the system, and then they would be rewarded with half of the cost, or they would receive half of the savings from that. The other thing that the healthcare trust would talk about is we really, as a country, should be able to negotiate drug cost prices. We're the only industrialized country in the world that doesn't do that. I mean, that's got to change. The other thing that we can work on are complications. Perhaps doctors can be given bonuses for if they take care of patients that don't have complications after surgeries. So in other words, let's take my hand for example. I got MRSA from my doctor's outpatient clinic when they were doing the tendonitis, whatever they did to my hand after they did the surgery. Now, sure, the doctor's going to be paid for taking care of the complication, but if there was a doctor that didn't have a string of complications and he was able to keep his patients well, then perhaps those savings could be passed on to the doctors. The other thing to keep in mind is that it's just not the individual that's paying this tax. It's also the income resource. So, for example, your job, has to buy things, and so there would be a tax on the things that the company buys, which would, add to taking care of its employees. And so once again, I want to wrap this up because this is pretty much it in a nutshell. Is you have the individual who will choose their own doctor, their own hospital. They would choose a private risk management company or insurance company, which would pay a set fee for the number of individuals they're collecting data on. They would send the information on what's causing illnesses and injuries to the healthcare trust fund with the percentage of the tax, whether it's a 2% tax or even 100% tax on individual items that are being purchased. The individual goes to the store, grocery store, hotel, car, home. The tax is applied there. The healthcare trust fund collects the money, pays it to the doctor that you chose, pays the fee to the private risk manager company that you chose. The income resource, which is paying you an income, has to purchase things from the market, so they're paying tax. And the last thing I want to point out is that the people that don't have a job, right, the homeless people that you see on the street, they're alive because someone is giving them food and water and shelter. Because if they weren't eating, they would be dead. So if they're alive asking you for money, or if they're alive and they have to go to the doctor, that healthcare cost is recouped at the store when whomever is feeding them, whether they're getting the food from a food bank or a church or a charity, or if you give them money and they go to McDonald's, they're paying for their healthcare cost there. So if you are consuming food, beverage, you're going to contribute to the health trust fund. So there is no free lunch. Now, yes, this would increase the cost of everything. However, I would like to point out that there would not be Medicare, there would not be Medicaid, there would not be deductibles, co-payments. The entire system, us living in America, is how we could collect the cost of health care. Well, this is the national point of sale healthcare tax in a nutshell. I appreciate you spending time listening to my idea, and if you like this idea, then send it to a friend, send it to Bernie Sanders, send it to Hillary Clinton, send it everywhere. Maybe our campaign, the rest of the season, we could actually spend time not pointing fingers at one another and calling each other horrible names, but could we maybe talk about something that's important, something that's a little more relevant to what's going on in our country, as opposed to who's not trustworthy and, you know, who hates who more? I don't think people care. Well, anyway, thank you for sharing a few moments with me and my ideas, and I wish you and yours the very best, and may we all find peace in this lifetime. Much love. Take care.